Can you hear me?
Welcome everyone. This is Jeff Feinman here with Christina Shambra. We're both veterinary homeopaths practicing holistic veterinary medicine, and we're here today with Joe and his 18-year-old kitty. And we're going to start today just by saying what's going on. First, Joe, what is your kitty's name?
Joe Jr. Call him JJ.
So he's a he, I guess.
Yeah. So I know you're not. I know you're doing something specific, but you came up. I'm on my way out the door here in about 20 minutes. But I just got off the phone with my wife. He's about 16, and he's just had a lot of weight loss. I'm gonna let him go here. He's had a lot of weight loss and some trouble. We took him to the vet a couple weeks ago and got him hydrated. And the lady, we got some tests done. All his blood work and blood work came back fine. They did say we may want to get some imaging done, but we haven't done that. We don't really want to put him through too much because he's very frail right now, and he's an inside cat. But the problem that I'm having is just today, he started to wobble a lot. We started to feed him a lot more because the vet suggested we give him more protein and stuff to try to get some more weight on him. And he loved it. We've been giving him treats, giving him chicken, giving him, fancy feasts and tons of water. But he's been going in different places of the house, which we've kind of fixed with treats and stuff. But last night he had a huge accident, poop accident in the living room. And today he's just super frail. And I don't know. I just came across your blab and didn't know if you had any
glad you came. Do you know what we're blabbing about in general?
No, I don't. I just saw a holistic pick here.
I know. I'm glad.
Well, that is a holistic pick here.
I wasn't able to get up. You're back, Chris. You were gone. Now you're back.
You were cut off.
That what we're trying to focus on more is supporting our clients that are all treating their pets with more natural methods, and we happen to be homeopaths, which is a subset of holistic medicine.
Okay.
And a lot of the local vets don't really have a lot of holistic veterinary training, so we're trying to integrate. So this is a great example, Joe, of
cool.
Hi, Ivy. Thank you. Perfect. This is a great example of how we can integrate, and this might be our new model for the future. Who knows? So, is your kitty eating?
Yeah, oh yeah, like crazy.
Is he eating more than usual?
Yeah, we've tried mixing up a bunch of different things because he seemed to get sick of the food we were using for him, and so we started giving him the cat food, the fancy feasts and stuff like that, and he loved that. And then, like I said, the vet suggested we give him some chicken, just some regular baked chicken, and we started giving him treats, and he's all over it. Even this morning when I got up, my wife was in here and she gives him treats before she goes to work. She said she almost came and got me because he was wobbling so much. Like, I don't know if it's the arthritis in his hind legs or what.
And do you know, because I know you said the vet ran some tests, do you know if they ran a thyroid test?
Yeah, that was one of the things they were worried about, and everything was fine. Everything was normal.
And the examination was normal?
Mm-hmm. Yeah.
Was he running a fever?
Nope. We came back actually very happy with everything and thought all we had to do was just make sure that he was super hydrated and started feeding him like crazy. I mean, he doesn't stop eating all day, And that's what the doctor was worried about, was his appetite, was why they were worried about hypothyroid.
Sure. Do you know offhand, did they run a test called a free T4 or just a T4?
I don't know that.
Do you have the lab results right there?
No, I don't. They just talked to me on the phone.
Okay. Because they can. There is a subset of, and do you have any other questions, Christina?
Did you? Where do you live?
New York,
what
Rochester,
area of
New
the
York.
country? Okay, because with what's going on, the very best for you would be to be able to work with someone who does, a veterinarian who does homeopathy, or a veterinarian who does really good traditional Chinese veterinary medicine. Do you know of anybody in your area that does that?
The doctor we went to actually does. That was part of their credentials, was their holistic approach and their Chinese medicine and stuff. But we didn't ask about that or anything like that.
What is their name?
Suburban Animal Hospital.
And what's the name of one of the vets?
It was Dr. Fisher was her last name.
The one you went to.
I can find the link.
Okay, I think part of the problem is your internet signal is popping in and out, Christina. So I think you said that you don't know the veterinarian.
No, he said it was Dr. Fisher.
Yeah.
Yeah.
Jeff, did you get that? Okay. So here's the thing. On my website, first off, it's good to know the websites for Jeff and I, because we have a lot of information. Jeff has a ton on his. So my website is myhealthyanimals.com. And then there's an articles section that has a ton of articles in it. And one of them is selecting and working with a holistic veterinarian. And so that will help you, for everybody else who's on the call as well, it helps you choose one, but also when you're working with one, it helps you know what to be expecting. And with a holistic veterinarian in particular, they should be, if they're a good holistic veterinarian, they will be open to you saying, wait a minute, we're going downhill here. And if you look at, again, at my website has the early warning signs on it. I think Jeff's does as well. There are a bunch of early warning signs. And so if those aren't improving, along with any other, even if other symptoms improve, there's more work to be done. So at this point, I would definitely be immediately calling Dr. Fisher and saying, my cat is not doing well. Okay, because weight loss with strong appetite, with a large thirst, with a large urine output indicates, probably a metabolic disease that could be treated with traditional Chinese veterinary medicine or acupuncture. For those of you who don't have good vets near you and don't have a homeopathic, any holistic vet near you, homeopathic veterinarians can help you by phone.
What was your website? Can you put your website in the chat and so I can bookmark it? I didn't catch it because you're breaking out. But
sure.
Get back to your blab, though. I really appreciate it.
As well put his.
Sure, but the other thing I was going to add is, do you have any veterinary that you're aware of, veterinary internist up in your area?
Oh no, I wouldn't know where to even.
Okay, let me send you the link so you can look into it, because that, if your regular vet is great, and I love her because I saw she has a standard poodle, which is also the kind of puppy that I've got and love standards.
She's very good.
If she gets to the point, because I would agree 1,000% that you need to give a call today, because a wobbly kitty, that's a little bit be concerning. Let me just get that. Give them a call before they close.
Sure.
Let me just get you the link for referrals, though I'm sure that she can give you, because it looks like she's a Cornell vet graduate, so she can. Here we are. Okay, there's the link. So,
she actually been specialized in clinical pathology, so so she should know some answers about that. If you get back to her and say, things don't look like they're improving.
So there's specialist, and my link is And Joe, I just want to ask, what do you play? Because you're a musician, I guess.
Oh, piano. I'm a piano teacher and musician. JoJoKeys.com is my website.
Okay, great. Cool. Well, thanks for coming. Will you do us a favor and just give a shout out to one or both of us what they find out about GJ?
Yep, absolutely. Thank you very much, guys. Have a great blab.
All right,
Well, there are a couple of other things. If you still have a few minutes, Joe. Yeah. Okay. So the other is, as CentraCat is eating almost anything at this point and liking a lot of, now's the time to really try to feed fresh food. So for everybody, what's the best food for people to eat? Fresh or processed? Fresh. Yeah. So cats and dogs have ripping and tearing teeth and bone crunching teeth. They need chunks of meat and bones, or
yeah, we were listening. Sorry.
I really appreciate your
although
time.
Not always, given that most dogs.
Anyway, she's trying to say, I think, just feed as fresh as possible. We're agreeing 100% with Ivy, who's saying variety is the spice of life. There's a document on my website on fresh food feeding. Start there. Look on raw foods. Again, Ivy talked about organic foods. That's your best bet as well. But, fresh versus processed. But again, right now you're in a more acute situation, so you need to first give your local vet a call and see if they can either talk or see you.
Excellent.
All right. Sorry.
And another one. Hate to give you too much here, but whoops, he's gone. Oh well, Reiki. Reiki is so important. So everybody else who's still on the call, Reiki is one of the very best things that you can have your hands be healers. And especially if you offer Reiki every day, that can make a big difference in preventing problems, because it'll fix issues before they actually turn into observable symptoms. And when I say Reiki, it can be Reiki, it can be theta healing, and any other energy healing approach, reconnective therapy. There are many of them. Reiki is just the one that's most readily available.
Okay. And there's Joe's handle on
the rest
Twitter,
of you
so that's
have
great.
Questions.
And I think I saw that Ivy also. Ivy, are you still here? I thought I saw in one of the other chats that, yep, great. Did you want to talk a bit about your kitty and organic food and processed foods, or is there a problem? No. Okay.
I think she was just suggesting to him that he feed organic food, that's better, and feed variety. I think she was commenting what's best, which is so true. Grass-fed beef. There we go. No dry food. Yes, absolutely. Very important. Yep. You know what we're talking about.
Yep.
And it's also
sounds like Ivy is a knowledgeable insider.
And it's not Ivy. She's got another name. I wrote it down and now I can't find my note. Raw organic chicken. Absolutely. And not just organic, but it's really important. Amy is her name. So Amy, you are so right. And it's not just organic, but it would be wonderful if you would find pasture reared that is also using organic grains, or maybe they're using, there's a kind of chicken called Icelandic chickens that don't need any grains. So then they don't even have to worry about whether they're feeding organic grains or not. They just forage on the pastures and things they turn up. So that's wonderful. But you're definitely doing great. Amy, what kind of animals do you have? Cats or dogs?
Yeah. Yeah,
Now
a
that
lot of my clients say that a lot of the time that their pets eat better than they do.
especially husbands will say to their wives, "Hey, you're feeding the pet better than me."
Yeah.
And we don't want to have that. We all should be eating just as well as well. 2 kids and 1 dog, very good. But now, truly, I'm serious, Amy. Discover what stops you from you eating as well as your pets, because it's not that hard to include you with your pets. If you aren't healthy, you're not going to be able to take as good care of them. So take care of yourself too, please.
Yes.
That's good that you're vegan, and that's a good way to stay healthy. Absolutely.
Yep.
Especially if you're getting good ingredients local or raising them yourself. Good for you.
But you can still share all the fruits and most veggies, or most fruits and all the veggies, and certainly tofu and khichdi. I don't know if you eat a lot of khichdi, the Indian basmati rice and lentils. Actually, my pets love khichdi when it's either plain or mixed with other things, and that is all vegan, so, and gluten-free. And because everything I eat is gluten-free, but my pets don't all eat gluten-free.
And
yep.
she says they eat eggs too, and pets love eggs. Eggs are excellent for dogs and cats, especially if anyone has dogs or cats that have any joint problems at all. If you peel that inner membrane out of the eggshell, that is full of chondroitin. So it's excellent for the joints. And I had trouble peeling it out. And I was at a friend's house, and she raised her own chickens. And these were super fresh eggs, and I had no difficulty at all peeling it out. And my cat actually adores it. Down for him, and he just scarfs it up. So even if there's not joint problems, it's good you can.
Yeah, there are a lot of components in the eggshell membrane. In addition to the chondroitin, there actually is a supplement called Phytoplex. I'll write it down. That is just concentrated eggshell membrane. And I use it a lot. It's from the Wonderside people that make a fantastic organic cedar spray. Cedar is one of the strongest natural oils that will both prevent and treat fleas and ticks. And again, Phytoplex, I think I would have found, yep, Phytoplex, yep. And they also make the neem bark powder. It's like you're in the office with me, Amy, looking right in front of me at all the stuff on the shelf. So yeah, and Christina, I'm sorry we lost you again. Nova, are you still here? I can't tell who's here. Or let's see.
No,
Yes, there
I'm
you
here.
are. All right, cool. Oh, I see.
Here?
Yep, it does say Marie. All right. So, Nova, do you have any questions before we go to any other topics about any of the other pups? And did you mention last week that you had gotten a new puppy, or were you just referring to, Tater Tosha as puppies, because they are like puppies? Okay, got it. Yep. Okay, so Tush. Got it. Okay. So are you doing this blab on your phone, Nova? You said, I don't know if you're saying that you are out and about. We just lost Christina again. I'm afraid that it's a bandwidth problem there. Looks like, okay. Okay. So you can see yourself, and it says that I have a bad internet connection. That's weird. Because we can't see you. Okay, well, regardless, can you Now you can't see me either. Yeah, I think that might be because your bandwidth is lagging up. There you are. You're back. Okay. So let's see if we can get you back on. Let's see what happens. There you are. You're back.
I'm back.
You're
It
back.
still says you have poor internet signal.
Does it still say that?
Yep. Nope. Now it's gone. Now it's cleared up.
So, was there anything else, Christina, that you want to talk about food-wise? Because, you know, in my mind, we can really summarize everything about food in 3 words.
Fresh.
Fresh.
That's 2.
Yeah. Fresh, variety, and moderation.
Good. Very good.
Is there any?
And I would add individualizing. Make it 4 words because you have to individualize for each animal.
But I guess we need to individualize. We should be individualizing everything.
Yes. Yes,
and
absolutely.
That is a new buzzword in conventional medicine, which is kind of ironic that they're now just starting to try and individualize medicine and personalize drugs and give only the right doses, when of course that's something that we've been doing that homeopaths have been doing for hundreds of years. And now we lost you because...
No, I'm not really gone.
Oh, there you are. So I did also see, not to change the topic, but I did also see that there was a blab going on when we went on. I was going to jump on, but I was afraid that I wouldn't get here in time, on autism and vaccination. Did you happen to catch any of that?
I did not. I didn't see that one. But when I, this summer in June, I was in Bali, and the conference that I spoke at, aren't I the lucky one? The conference I spoke at was an Australian organization that has been really looking at autism and treating autism and other, not just autism, the entire mental, emotional spectrum. And the connections with vaccines in their mind is absolutely true. And that's true for many people here. And interestingly, for you and I, Jeff, because we tend to be homeopathic prescribers that generally do one remedy at a time, there was a one of the speakers there was following the CEAS protocol.
We're losing you. Yeah, nope, we lost you, sorry. You said one of the speakers. Okay, so it looks like we've lost Christina again. So I am recording this, but it's not sure there's going to be that much of a good recording in this. I think we can hear you, Christina.
Can you hear me?
We actually can hear you.
Okay.
Yep.
Okay, excellent.
Yep.
Because I can still see the picture of myself. That's what's interesting.
Yeah, there's a picture up there, but no video that I can.
And talking, and so I wonder, it may come across in the recording. We'll have to look. We'll have to go see how that does. So I was just finishing saying that sometimes some protocols can be looked at just the same way as when we're thinking about a dog that is limping, the remedy Rustox may come into our mind. We may think about using Rustox, even though we're going to individualize the case, but we'll still have certain remedies in our mind. We try to put them aside while we're looking freshly at each individual. But the same thing with autistic children, they're going to have certain homeopathic remedies that they'll be thinking of. And that's really part of how the CEASE protocol works. So that's definitely something to look into if you're dealing with that issue.
And, I think, and again, that's part of the reason I think that we're both here today is, I think it's really, really important for everyone to know that there are options that really span the spectrum. You go to your doctor with your sick kitty or healthy dog or, a child that's having a problem. They may only give you one or two options, but if you look around or you talk to others, am I echoing to you, Christina? Because
a little bit, not bad.
For some reason, it's got a real bad echo on my end.
A little.
All I'm trying to say is that if you investigate, that there always is, like with the Rustox example, and individualizing the treatment of the individual, of the person or animal, there is almost always something else that you can do. And if you're only given one or two options, you should probably go ahead and try and inquire further about the other options that we know that are out there. And, Christina, I know that you deal with a lot more of the holistic options than I do, because, pretty much aside from diet, lifestyle.
I really get. Yep. Can you hear me now?
We can hear you.
Oh, okay. You were frozen there for a minute. I do, because the reason I deal with many of the other holistic options is because I teach and speak so much around the world that I'm trying to empower people to do as much as they can at home to be able to heal their animals, because often they don't have access to the holistic care from a professional. For instance, I lectured and spoke in Hong Kong, and there is currently one homeopathic veterinarian there, according to Steve Blake, per the Japanese veterinarian who does holistic, but we can't seem to track down the name or contact information. So at this point, the people I taught have no access to a homeopathic veterinarian, only homeopathic people doctors. So by empowering them to do things at home, not just homeopathy, but Reiki and flower essences and acupressure, which are totally safe, they get to help cure some of their animals' problems.
Great. And that's exciting. In Hong Kong, wow. When were you there?
Right out, that was as I flew home from Bali, because my plane was going through anyway. So it was mid-July that I was in Hong Kong as I came home from Bali. I had 2 layovers in Hong Kong coming and going. So on the one coming back, I did a 4-hour course. Had 22 people.
Well, great.
That came to find out how to treat their pets. And luckily they spoke English well enough. We didn't need a translator.
Wow. That's exciting. Very exciting.
So that was great.
And you got to tour the city a little?
Okay, let's. Little.
And again, Amy and Nova are both pointing out how poorly, unfortunately and unnecessarily, how poorly
little bit,
the conventional medical system does, individualize at this time. Nova's, one of Nova's dogs has dry eye, diagnosed as KCS. Actually, that I'm seeing right now, but which also homeopath Dr. Shack saw in was that North Carolina, South Carolina. He's also a great friend and colleague of both of ours. And Nova, why were you at the vet yesterday? I'm wondering. North Carolina, thank you. Okay, great. Well, I'm glad you got the blood work done, but the cyclosporin, and did you say steroids? Yeah, I guess you mean topical steroids in the eyes. They can only talk to you about what they know, what they've been trained to basically tell you and to investigate, and what they consider to be effective. And if they don't know about the other options, if they don't know that just keeping the eyes moist is going to help the body, or at least give the body a chance to heal itself if it's able, and that the homeopathic medicine will then push the body further along towards the optimal healing. If they don't know about that, they can't recommend that. So yeah, a big part of our challenge is to figure out what we can do. And by we, I mean all of us veterinarians and all of our pet owner clients and friends and everyone, what we can do to get the word out, not about homeopathy, but about just holistic medicine, about knowing your therapeutic options. And I can hear now that this is popping when I speak. Yeah. So yeah, and Nova is a pharmacist, and she's saying that she had the same experience, just getting out of pharmacy school and perhaps probably in school as well. Yeah, and again, Amy is right that the individualization that we're talking about goes all the way down to men versus women, male versus male, cats and dogs versus female, and vets for many years treated cats like little dogs. And you really can't, even if you figure out, the weight difference, it's not enough. But, one of the beauties of homeopathic medicine is that we can individualize, not only based on the sex and species and the weight, but by the symptoms that are being manifested by the individual at that time, because the symptoms are a clue to what's going on internally. The symptoms actually are one of the best clues, and sometimes the only clue as to what's going on internally. And that is basically how we are able to individualize our medicine. So what Dr. Chambreau, what Christina was talking about before, the rust tox was what in homeopathy is called keynote prescribing. So there's the rusty gait phenomena, where you're really stiff when you first get up, then you walk out of it, and the first homeopathic medicine that you think about is rust tox, which is, the specific, which is, known as, well, that's what you give if you have that symptom of big stiff and then working out of it. But really, that is just the first symptom that then helps you individualize the individual or the patient and decide what the right homeopathic medicine is. It might be rust tox. It might end up after 2 hours of individualizing. It might end up being rust tox. But we need to go through that process of knowing who the individual is and getting to know them from the inside out, from the beginning of their history to their current history. You gotta do that entire process to be able to individualize properly. And Christina, do you have any comments while I read?
Had I ever? Can't hear you, Jeff. What are you saying, Jeff?
You're unable to hear me? I was just wondering if you had any comments about, can you hear me now?
Yes, it was when you turned your head.
Oh, sorry. Just wondering if you had anything you wanted to add to individualizing.
Well, first, there was a little chat here about Nova had been to pharmacy school, and I did a year in pharmacy school before I got into veterinary school. I had always wanted to be a veterinarian, but back in 1970, when I finished my 2 years pre-vet, I wasn't able to get in at that time because I was a woman, and they only took 2 women. So I did get in after 1 year of pharmacy school. So individualizing, yes, individualizing remedies or any treatment is key. And that's why when my clients after 20 years bugged me for writing a book, I said, other people have written books. There's nothing else needed. And I thought about it as they kept bugging me, and finally wrote a book called The Healthy Animals Journal, which we spoke about a little bit last time. And that is a key way for people to be able to individualize what each of their animals knows. There it is. And just because there's a cat on the cover doesn't mean it's just for cats. It's for dogs too. You cover up that picture of a cat with a picture of your own pet. It has little slits in the cover so you can stick the pictures in. But that is the key to individualizing, because what you do, whether you keep your own journal or whether you use that book, is you number one, you have a list of all the symptoms your animal has ever had in the past and has currently, and you quantify them. Number 2 is you go through the early warning signs of illness. So you actually look at goop in the corner of the eyes, doggy odor, hairball vomiting in cats, pica, eating weird stuff in dogs and cats. And you make a list of any of those that are present. And then you start, number 3, then you start using treatments. You try something and you record it. You write down when you start using it, when you start changing the diet, when you start changing the exercise, when you change from a collar to a harness, which can improve health for many dogs, when you start doing homeopathy or acupuncture or any other, start doing Reiki every day. So you write those down. And then number 4 is you go back to the symptom list, to every symptom on the list, not just your current problems, and you look at all of the symptoms. And then you realize that this dog seems to be worse if you're not doing Reiki every day. That a little bit of goop starts coming into the corner of the eye. So that's an early warning sign. Or you notice that if this dog is not getting 1 tablespoon of brown rice in the diet, and it's a 100-pound dog, that 1 tablespoon of rice is what this one dog needs. So it's that matter of tracking the symptoms, and you gotta write it down. That's the important thing, especially practitioners like Jeff and myself. It's very difficult for us to remember to write it down because we think, oh, we'll remember, but we don't.
I actually have a record made up for each of my pets, and if I don't write in the record, I have a calendar upstairs for all the doses that I give, because if I don't write it down, it's no different for us than for our clients, for sure. And
absolutely,
you were mentioning and gave a great use for your book, Christina, which is sitting, as you saw, right here on my desk. Thank you, and I know Amy just emailed you to get some more for the office, because I know we're out. Yeah. I just saw the other day a colleague and friend of ours, Dr. Wendy Jensen. Have you seen any of her book?
I actually went through it. I got to read it before publication. I got to read parts of it and helped to do a little bit of editing on it.
I mean, what I was only able to read the excerpts from Amazon, and I think there was some elsewhere, but it looks like it's going to be a great resource for clients.
Absolutely. Very important. And she is talking in the book about individualizing, about really looking at different treatments for different animals and how you individualize treatments. So that is an important piece. Do you remember the name? I'm drawing a blank right now.
No, but I have it right here. So I'll pull it up, actually. Okay. Sorry. But her name, actually, I should just write.
There are so many good books and good resources that I keep stumbling across. It's like every moment I find something new that's wonderful. I just found a great Reiki resource. And for those of you who don't know about Reiki for shelters is one of the best things that you can do. Flower essences as well. But Reiki, you can just sit in the aisle of a shelter when you're volunteering and send Reiki in general to all the dogs and cats that are there. And it'll make them more adoptable. So that's the name of it, On Homeopathy for Animals?
No, I just wrote that as far as that. Here, I'll get the exact link, actually.
That's good. So that's why I really encourage people to learn Reiki, is because it can apply in so many different ways. So the next thing, let's see, we have about 15 minutes more to go, Jeff.
Yep, it's called here. It's Practical Handbook of Homeopathy, and it just came out. So let me go back.
It's just been out for a few weeks. Very, very new.
Yeah.
So for all the people that are on the call with us today, be sure you write down, send us a message and say if there's a specific topic you want to talk about. Our goal is really to empower you at home to be able to do as much as you can at home and then be able to select the right caregivers. And so for me, part of that is to make sure that everybody has access to all the different veterinarians that you can work with. And so I have on the links page on my website, I have all of the different organizations. So you can go to those different organizations. And there's always the most wonderful thing about homeopathy is we can do it by phone. So if you go to the website for the Association of the Academy of Veterinary Homeopathy, which is theavh.org, you can find, by putting in the search button for phone consults only, you can find ones who can help you by phone, like Jeff does, and like I did for 35 years. And so now I'm doing, instead of actually being the vet, I'm doing pet health coaching. So I help people discover, given what they know about homeopathy and what they know about holistic medicine, what do they need? Do they need to be doing Reiki? Do they need to be doing flower essences? Do they need to work with a Chinese medicine practitioner veterinarian, or can they work with a homeopath? What's the best for them? What's the best for their animals? So we work through that and get them sort of started on the right foot. And then sometimes they'll track back to me after a couple of months and say, I don't think this vet's the best one, and here's why. So let me work with another one. Because I got to tell you, I've been doing this since the early 80s. And so I know a large number of the veterinary homeopaths. And it's interesting, for every person who complains to me about somebody, like, I really don't like working with, now, obviously you guys know Jeff. So from this lab. No, this is going to be funny. So they'll say, I can't work with Jeff because he talks so loud and so fast that I can't understand what he says. And so somebody may complain to me about that, and I know Jeff, so I know that that's their perception of him, and it's not true for everyone else. But I would then match them up with somebody. I would think about someone who I know, maybe Stephanie Chalmers, who has almost the voice of a whisper. So I would think about who has, really the opposite. Or I would coach them, and I would say, if you feel that Jeff is speaking too fast at some point, ask him to slow down, and tell him that he's probably speaking normally, but that for you need him to be extra slow, and make it okay that he speaks very slowly.
You're right. I had to laugh at that one. Sorry. I'll try to slow down for you, Christina.
So that's the point, though, is different people. See, we're back to individualizing again. We're individualizing the practitioner you work with. There was actually this very good homeopathic practitioner in New York City, in Manhattan, who I kept hearing horrible reports about. And it turns out that he had really issues. He had, I don't know whether it was autism or what, but he had issues in working with people. But he was caring and gentle and passionate about helping animals. So he was a good person to send people to, but I had to just coach them and say, you have to be the person being proactive. He's not going to explain things to you. So you need to ask the questions if there's no one else for you to speak with. So sometimes it's up to you to help figure out what you need to do to have the good relationship, or simply move on to another veterinarian. And that's true whether they're conventional or not. And these days, I never used to say this because I wanted to keep doors open more. But there are enough veterinarians now trained in holistic medicine, even if they're not great, and enough conventional veterinarians with no training who are at least interested in talking about holistic approaches, that you shouldn't go to one. Find one that's not going to yell at you and not going to push cyclosporin for the eyes. Go to them, and, I go to an internist who's totally not holistic, and she'll say, well, your cholesterol is still up, but I know you're not going to do anything that I suggest about it. And that's okay. You're right. I'm not going to do what you suggest about it. Let's see what happens on the next blood test. I'll try something different. But I'm going to her because I respect her fingers, her ears, her eyes, to keep me on track in terms of how I'm doing holistically. And some good news is the Virginia Veterinary Medical Association is actually doing an entire day on homeopathy at their annual conference. We have 3 speakers, Sid Starosum and myself and Marge Luter, and we're doing a tad of herbal and then mostly holistic, and then a tad of ethics and general how to have a healthy practice. So 4 big lectures on homeopathy. Isn't that exciting, Jeff? I love it.
Sid was mentioning that on the board, to the board. And yeah, the more that we can get out there, the more education that we can have for everyone, the vets as well as the individuals, the better that we're going to be. I believe Stephanie also had wanted to give us a little more information about what it is. I guess she said they make herbal formulas for pets. So Stephanie, did you want to give us any more information about your formulations? And it looks like you're fairly active here on Blab.
What's the website? That's what we need, is the website. Okay. When people get the recording, Jeff, do they also get the chat?
That is a good question, and I don't know. If you go on YouTube, you can see the recording from last week or 2 weeks ago.
Okay. but you haven't looked.
It's up there now, actually. So, but I don't know if the chat is included. So that's a very good point. We probably should be
in case it's not there, we want to say it, which is www.chiblends.com, and that's spelled QI for chi, and then blends, BLENDS.com. So everybody check that out. And of course, we've talked a bit about what we do, that I do pet health coaching, and Jeff does in-person and telephone homeopathic treatment of animals. And Jeff, can you tell us one or two cases, just in a word or two, that you've just seen a cure in the last week or two?
It's interesting because right now, like within the past couple hours, I have two patients, both of which have diarrhea. And we're talking diarrhea like water squirting out all over the house. But this brings us back to the individualizing situation, because both of these people said their pets have diarrhea, but their diarrheas are totally different. One is watery, squirty, smelly, excuse me, diarrhea. One is passing with straining and mucus, and they both got two different homeopathic medicines, even though they both have the diagnosis of diarrhea. They both also went to their local vet, and this, I think, brings up another really great topic, and that is that you can be really sick and have lots and lots of symptoms, but the exam and the blood tests and the x-rays are all normal. Well, that doesn't mean that you're not sick. That means that you're imbalanced internally in such a way. It's what we call functional versus structural change. But you're imbalanced in such a way that it's just not yet showing up in the conventional medicine, but the body never lies. So the body of
just like
the one that
this morning, the cat with Jojo, he was fine with all the blood work, but is critically ill. That cat's not in good shape.
A wobbly cat is never especially if you just receive fluids. But
so it's very true. So did both those diarrheas clear up?
They both resolved. Yeah, actually, one of them is still coming and going after a day or two, but there was nothing else that could be done except, conventionally, except put them onto antibiotics and anti-inflammatories, when of course our job is not to use antis, which are working against the body, but to we try to work with the body, which is of course what homeopathy is homeo treats likes, versus antis, which are, again, anti is the same as against the body.
Well, I think that actually summarizes what this whole blab is about, for as long as we do this blab, is learning ways to take care of things at home. So neither of these people really needed to go to the conventional vet necessarily right away. And that's the piece that people need to learn about, in terms of how long can I wait? If I've gotten hold of my homeopath, can I feel comfortable waiting? And part of that is growing and learning and experience over time. Part of it's the homeopath saying, well, I think you can wait. Let's wait 24 hours and see what the remedy does. One of the ways that you can tell is by the energy level and the activity of the animal, and looking at the early warning signs. What is normal in an individual is different. And if you're tracking the early warning signs and keeping a journal, then you'll know what's normal or not normal for each individual, pointing to what Amy was talking about.
Yep. And again,
on her post, she said, what is normal? A statistical norm? The individual may be totally normal, yet still displaying clues. And then Angela says, how can I sterilize or clean a raw meaty bone for my dog? You don't.
Yeah.
Dogs in the wild don't sterilize their food before they eat it. Try to get your meat from a healthy source, like pasture-reared animals, and try to, but they're going to roll it in the dirt. You're going to throw it in the yard and let them just chew on it in the dirt. So no need to sterilize it at all.
Yeah, and in fact, that could be quite harmful if you cook the bone. One,
Right.
you're transforming the fats and making the fats not safe for them. They can actually get pancreatitis and other symptoms, but then you're also making the calcium in the bones hard and potentially dangerous. So yeah, if you're going to feed bones, feed them raw, for sure.
Right, and not sterilized. Now, if you're really panicked about it, you can run it through grapeseed extract, grapefruit seed extract. It theoretically sterilizes things, and it won't. I know it won't cause any problem, so wouldn't worry about that. I would not switch to can. I would switch back to cooked food, and we're pretty much out of time on this blab, and so we can't go into details. I think we talked about nutrition on the last blab, so go to the YouTube video. And then if you go to my website, you'll see a video of a panel discussion we did in Hunt Valley on raw food. And because of heart murmur and cataracts, I would definitely find a holistic veterinarian to work with.
And my only addition to that is, Angela, we need to individualize. So, you know, if your dog is cataracts and murmur and is 16 years old and is a poodle, that may be within the norm for the age group and the breed. But if it's a 2-year-old golden retriever with cataracts and murmur, something else might be going on. Yeah. That's a great face.
Either way, finding a holistic veterinarian is the best. That's what you want to do.
And like Christine said, that's pretty much all the time that we got today. So thank you all so much for coming, because we wouldn't be doing this if it wasn't for you guys. And do you have anything you want to add, Christina?
Nope, that's it. Just thank you all for being here. And some of you are now becoming regulars, and I'm glad to see, you know, new people pop on. We had someone just happened to be on Blab and noticed it and didn't know anything about holistic at all.
Got a free video consultation. There's actually now a service called Vet on Demand, where you can actually do video consultations with veterinarians. You may want to check it out, Christina. Next week, I'm going to be in Florida at the rescue group, so we'll be blabbing. You'll be at home, and I'll be in Odessa, Florida, with a bunch of barking dogs all around me, and I'm not sure how it's going to work, so it might be a little too noisy, but are you going to be able to be there, Christina?
I'm sure you will find a way to have it be minimally noisy, and we all won't mind some barking dogs in the background. I will definitely be there. All right,
great. Well, again, thank you all, and we will sign off.
Absolutely. Bye-bye. Hug those animals. Bye.